How frustrated are you to see the continued weight gain in your belly at midlife and at menopause despite doing nothing different in terms of your diet or your exercise regimen? Well, if you're anything like my patients, mid-belly weight gain is at the top of the priority list for you in midlife and at menopause. If that's you, stick around because in this video, I want to talk about why I think hormone therapy is beneficial to your waistline. I'm going to give you 3 reasons why I think it is absolutely beneficial to help reduce mid-belly weight gain and that mid-belly fat. And I'm also going to give you 3 reasons why, if you are gaining weight on your hormone therapy regimen, that we can make some adjustments and alterations in so that you don't have that frustrating mid-belly weight gain. So stick around because this video is for you. If you guys like this video and you like my channel, please subscribe over to Health by Heather Hirsch here on YouTube. Your subscription also tells the YouTube algorithm that this channel is valuable information for women searching all across the globe for things on menopause and midlife. If you subscribe, you will not miss any of my videos which come out every Friday. Welcome here. If you don't already know me, I'm Dr. Heather Hirsch. I'm the clinical program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital, where I live and work in Boston, Massachusetts. I would love to see you as a patient in my office. If you would love to do so, that is the best way to get personalized advice, and the number for the office is in the description bar below. However, if you don't live in the Boston or New England area, feel free to browse through my YouTube channel here. I'm also the host of my very own podcast, Women's Health by Heather Hirsch, which covers all things menopause and midlife. New videos come out on Wednesdays. You can also find that in the description bar below. All right, with all of that out of the way, let's get into today's video on why I think hormone therapy is beneficial for your waistline. All right, first and foremost, off the bat, hormone therapy is FDA approved to treat vasomotor symptoms, night sweats and night flashes, and bone loss, osteopenia, as well as genitourinary syndrome of menopause. I have a great video on vaginal estrogens, which I will put up here, which is all about genitourinary syndrome of menopause. But today we're talking about weight and hormone therapy. So it has to be used for one of those FDA indications. It's not FDA approved to help with weight loss. So here is my number 1 reason why I do think it is good for your waistline. First and foremost, hormone therapy helps women sleep. So for a lot of women, they have nighttime hot flashes, what we also call night sweats, and that keeps women tossing and turning all night long. It tends to just wake us wide up at 2 a.m. And then not only are you awake, sometimes women are drenched, they have to get up and change their sheets or even take a shower, and then it is hard to fall back to sleep. The lack of sleep destroys our metabolism. Sleep is so important for so many reasons. I preach about this all the time. The goal is to get between 7 to 8 quality hours of sleep every single night. When you sleep less than that, this can put you at increased risk for several chronic diseases, including high blood pressure, diabetes, weight gain, anxiety, and depression, but certainly it also crushes your metabolism. So sleep is so important. That's when our body sort of resets, digests, metabolizes everything that we've ate, and also helps keep your bowels nice and regular. So when I start hormone therapy for my patients, they report back to me that if they were having problems with sleeping, they sleep so much better. That in and of itself can really significantly improve your metabolism. We are such a country and globe of women who are so deprived of sleep that we forget what it feels like to get really good sleep, and to see how that helps us when we have a solid diet and when we are exercising. That's really, that poor sleep is curbing all those effects and just throwing them right out with the baby in the bathwater. So hormone therapy really helps people sleep, stop flashing at night, get back to sleep if they do wake up for any reason, and really helps that metabolism. Okay, reason number 2 is that the majority of my patients who use hormone therapy for any of those FDA indications start to feel better. They feel less fatigued. They overall feel more motivated. They've slept. They're not flashing all the time. And hence, they feel ready to tackle a healthy regimen of exercise, and they feel motivated to stay on their good, clean eating diet. Eating well means you have to meal prep, you've got to go to the grocery store, you have to cook most of your own meals for the majority of us. You've got to count your calories, put it in your MyFitnessPal, and I will link right here a video I did on how to use MyFitnessPal. And a lot of times when women start their hormone therapy, it's almost like getting the ball rolling to regaining that functionality that they had before their menopause symptoms started to take over their life. So many times my patients will say, wow, I'm sleeping and I feel good and I'm not flashing, I'm productive at work, I feel like meal prepping, I feel like making my own food, I feel like exercising, I feel like doing that couch to 5K or whatever it is. The majority of weight is actually really your diet, and maintenance comes from your exercise. But the majority of my women feel so much better. They thrive and they feel like themselves. And so that's another reason, that's reason number 2, why I think hormone therapy helps your waistline. All right, what is reason number 3? Well, reason number 3 is a little bit more scientific. Now I can't actually prove that hormone therapy is beneficial for weight, but what I can say, in multiple studies, including in the Women's Health Initiative and many other studies, we see that women who take hormone therapy have less progression to getting the diagnosis of diabetes. They also tend to have better cholesterol profiles. So what that means to me, even if you don't have diabetes or you don't have a cholesterol problem, is that estrogen does something directly to our gut. It plays a role in the way we metabolize insulin, i.e. our insulin resistance. So for example, if I eat a nice sugary cupcake, my insulin then goes to work and tries to get all that sugar cleared out of my system, get it where it's not supposed to be. That means I have a really good insulin functionality. But when we start to develop diabetes, if I eat that sugary cupcake, it really wouldn't do the same job that it used to. Fat can accumulate, mid-belly can accumulate, metabolic syndrome can accumulate, which is that mid-belly weight gain, the onset of diabetes, the onset of high blood pressure or hypertension, and elevation in our cholesterol. That's what metabolic syndrome is. So my belief is that estrogen plays a role in the way we metabolize sugar. It plays a role in our insulin resistance. Now, much more data is coming out about this, and I hope that we continue to do more research on menopause. It's clearly indicated. But what I find is that when my patients use hormone therapy, they find that after a good 3 to 6 months, not an immediate effect, but a good 3 to 6 months, they find that in combination with a good diet and exercise, their metabolism starts to work for them. Now, it's not a weight loss drug like Adipex or Qsymia that you might have heard of, but it works a lot more slowly because I think it is actually changing the way our gut and the way our pancreas and our liver and all of those like little proteins in our gut metabolize and break down our food. So those are the 3 reasons why I think hormone therapy is actually beneficial for your waistline. Comment below, have you been on hormone therapy? Has it helped you lose weight? What did you use, and what other tricks and tips did you incorporate in your lifestyle so that you could lose that mid-belly weight? Okay, next, I want to get into 3 tips for what I think you can do if you notice you are gaining weight on hormone therapy. Clearly, that's just what I've been saying, the opposite of what I've been saying, right? I've been saying that I think hormone therapy is good for your waistline. So many people will message me on social media or here on YouTube or on Instagram, and they will say that hormone therapy caused weight gain. Well, here is 3 things that I think it could be. Number 1, sometimes this can be water retention. Water retention can happen when we start a new medication, especially a new hormone, because it just changes the way our fluids work in our body. I've got some tips to help you get rid of water weight. Water weight can also make you feel very bloated. The good news is it is just water weight and you can get rid of it as easily as it came. My first trick for you is to use over-the-counter B6. Try and get B6 50 milligrams, and you can take this up to 3 times a day. That's a lot for some people. So even if you can take it once a day, maybe once in the morning or once with dinner, B6 is a nice natural diuretic. It's going to help you get rid of some of that water weight naturally. We want to get rid of water weight naturally because unnatural means or via other medications can screw up or change your electrolytes in a way that you also don't want, because that can lead to its own set of side effects. Another thing to do to help with water retention is elevate your legs. When you get home from work, put your legs up, let all of that water kind of run out. Another thing you can do is wear compression stockings if you don't like compression stockings, if those are too tight for you. Even just a tighter yoga pant can help basically just milk that water retention up out of your legs, out of your belly, and get it so that you pee it out. And lastly, drink plenty of water. Sometimes when we're bloated, we think that drinking more water is just going to have the opposite effect, but actually it is going to help you to work and get that extra fluid retention and that extra water out of your system. What is number 2? Number 2 is it actually could be the progestin component of your hormone therapy. Now, if you don't have your uterus, you don't have to take a progesterone. So really, you only need to take a progesterone if you have an intact uterus. I'm going to link up here a video I did on when, why, and how to use progesterone, because sometimes I think the progesterone causes the water retention, or i.e. some of the weight gain, not so much the estrogen. So if you're on a progesterone, you can try to lower the dose, which you should only do with your menopause doctor. You could also try to switch the type of progesterone that you're on to see if one is less sort of water retention-y than another. So my favorite ones to use are micronized natural progesterone, 100 milligrams at bedtime. Sometimes if people feel bloated from that, we could try using the norethindrone, which is in combi patch. Or another thing you could do is you could use an IUD, and an IUD can also help decrease that bloating from progesterones. And I will link a video up here I did on when and why and how to use an IUD at perimenopause and menopause for this exact reason. Okay, what is reason 3 that you could be gaining weight on hormone therapy? Well, this one is simple, but very important not to glaze over. Hormone therapy is not a complete band-aid. You have to have a good clean diet, and you have to be doing some exercise, arguably, if you want to see physical changes in your body and if you want to see that belly fat go away for good. So you've got to be able to incorporate exercise and a healthy diet into your lifestyle. It is not a magic bullet, and unfortunately there just is no magic bullet in the world. Even the weight loss medications that are really dedicated for weight loss, like Qsymia, like Contrave, like Adipex, are really only supposed to be used for a short amount of time for you to get the weight off and then keep the weight off with the healthy habits that you should already have, which is clean eating and incorporating some exercise. So if you are gaining weight, do a good hard look at what you're really eating. You can do a food diary. They're painful and they're awful. You know, you have to write down everything you're eating, including licks and bites and little pieces here and there. But when you really start to look at it and you count your calories, you might be seeing that it's actually just your lifestyle that's causing the weight gain. I know that it's hard to hear. I hate to say it, but I'm right there with you. You are not the only one that struggles with mid-belly weight gain. Almost every woman does, and especially because that metabolism decreases when we lose our estrogen into perimenopause and the menopause transition and postmenopausally. Okay guys, I hope this video was extremely helpful to you. But if you are still wondering and have lingering questions on hormone therapy, if it's right for you, what kind is right for you, how to find a doctor, I have the resource for you. I completed the course, The Complete Guide to Menopause, for you. So for anyone who wants a really proactive deep dive into all things menopause, go ahead and look in the description bar below. You're going to find a link to my course, The Complete Guide to Menopause, everything you ever wanted to know that your doctor never told you. It's filled with PDFs, worksheets, resources, tons and tons of slides, so you can really break it all down. If you don't want to take the course, you can also please, I refer you to my podcast. They're a great source of information, and check out all the videos here. Don't forget to like and subscribe to my YouTube channel. Your support means the world to me, and growing this YouTube channel is so inspiring and motivating because I love helping women across the country find the right type of the right type of information and to make the right decisions for themselves. Thank you guys so much. I'll be out with a new video on Friday. See you then. Bye.